Wellness Wednesday, sponsored by Baptist Health.
Welcome back. High blood pressure can go undetected for years. In fact, office blood pressure measurements just once a year can also miss it. But could the answer be on your wrist? Here in the studio is Baptist Health cardiologist Dr. Scott Davis. Dr. Davis, good morning.
Good morning. Hey, before we jump into our topic, we got to give a shout out to our urology buddies. No Shave November.
Okay.
Prostate awareness. Go to either your family doc, our friends at Arkansas Urology, my buddy Tim Langford over at the UAMS Urology Department. Get you, if you're guys, get your PSA checked. This is the time to get aware about that. You know, the top three for guys: heart disease, colon, prostate. For ladies, women, it's heart disease, colon, and breast cancer awareness. So this is our opportunity to kind of promote a PSA awareness and prostate awareness. So that's my promotion and my PSA for the PSA. So let's talk about the new feature on the Apple Watch.
Okay.
We've talked about the feature that I don't have an Apple Watch on, but the AFib detection uses this technology called PPG, photoplasmography, which is an optical heart sensor technology that not only can it check and measure your heart rhythm and that AFib detection, now it's built and designed to detect if you have a tendency towards high blood pressure. Look, it doesn't measure, it's not a substitution for a blood pressure cuff.
Okay.
It does not give you a number. If you already have high blood pressure, if you're seeing somebody like me and you're on blood pressure medicine, this is not directed to you. This is, you know, I tell people, I've said this for 20 years, for as much emphasis as we put on high blood pressure, like you were just saying, grabbing one number out of the office is kind of bad science. We want to see kind of where you're living those other 364 days of the year. And so this is new technology moving health management into the more commercial space to check on blood pressure. And so what it does is it gives a 30-day assessment, a 30-day reading of, is there a trend towards what is labeled as potential hypertension, just to identify and trigger folks that walk around otherwise not knowing they may have high blood pressure, to then move towards a doctor and get a blood pressure assessment.
Dr. Davis, do you check those numbers of your patients, or do doctors use that?
So so it's for somebody that doesn't have high blood pressure already, right? And so if then you get the warning, then that is this trigger, this signal, maybe I need to go get a blood pressure cuff and be more proactive. The problem is, a lot of people walk around with high blood pressure and don't even know it. There's a few exceptions. You might have a headache. You may feel flushed. But this is a trigger to say, hey, wait a minute. You know, maybe I need to be more attentive to my blood pressure assessment, go out, spend the extra $35, $40 to get the cuff, and then be more proactive about kind of owning what your blood pressure is.
Dr. Davis, I learned so much when you're here.
Man, thanks.
We need you here Monday through Friday.
Glad to be here.
Well, here's the Baptist Health info on the screen right now. For more info, go to baptist-health.com or call 1-888-BAPTIST.